hips started to really act up and get inflamed, and they were getting very, very painful. But my own physician, Dr. Gerlach, suggested that I go see Dr. Kepley at the Crystal Clinic, and that's where all that started. I went to Crystal Clinic down in Cuyahoga Falls and met Dr. Kepley, and he's taken care of me since.
Diagnosing hip joint problems can be fairly straightforward if you have a grasp or an understanding on where the body will refer its pain symptoms. Hip joints cause pain almost exclusively in the front of the leg, in the groin area where the leg essentially joins the rest of the torso. Hip problems also tend to refer their pain down the thigh and towards the knee. So patients presenting with a bad hip will have pain in the front of their leg. They'll also complain of a lot of stiffness, difficulty crossing legs, difficulty putting on socks or tying shoes. When Ted Conlon presented, he basically had problems with both hip joints and one knee joint. His hip joints were his most pressing problem, causing pain with his daily activities as well as affecting his golf game. So we elected to replace his hip joints first, one at a time, about 2 years apart, and he got through those remarkably well. And then just this past December had his knee joint replaced and did remarkably well with that.
Dr. Kepley's a nice man. What impresses me, besides his appearance, skills, which are wonderful, is when you go into his office and you talk to him, you aren't rushed. He'll spend as much time as you want to talk about your ailments, and he'll get to understand you as a person, not just a patient, not just a number. He'll understand why you want to do what you want to do and how the pain is stopping you from doing it. He's a very nice gentleman, and my wife and I really enjoy meeting him over the years.